This is Dr. Tunde-Byass. I am an obstetrician and gynecologist. Welcome to our video series of pregnancy in the pandemic. I will be discussing video number 4. Please click on the link to fill out our anonymous survey that we will use to research the impact of our educational videos on you, and if we need to make any more improvements. Thank you. So my talk today is looking at weeks 20 to 28 weeks. As you know, prior to the COVID-19 pandemic, you would have been seen every 4 weeks. Because of the pandemic, we have structured your visit to include in-person and also virtual visits. This would affect your pregnancy in any way. If you have not seen your healthcare provider at all, you will be asked to come in at 20 weeks. Otherwise, you would have a phone visit at 26 weeks. What do you expect? Your healthcare provider will discuss your anatomy ultrasound with you and let you know if it's normal or not, or you need further ultrasound in the future. Furthermore, you would need a repeat blood count, specifically looking for low hemoglobin and whether you would require extra iron supplements. In addition, all pregnant women will be screened for diabetes at this stage. Lastly, in this time, you may be required to receive a RhoGAM injection, which is given to all women who are Rh negative. So let's talk about the gestational diabetes. This is high blood sugar levels that can cause problems to you and your baby. For the baby, your baby could be overweight and you can experience difficult vaginal delivery, or you can go into early labor, or the baby could have breathing difficulties, low blood sugar, or could be stillborn or develop obesity in later life. And for you, you may develop a high blood pressure and there may be a need for high cesarean section and of course, future diabetes. There are risk factors. One is being overweight, or there has been lack of physical exercises. And you have had this problem in the past in your previous pregnancies, or you have a very strong family history, or you are over 40 years of age. Some people might have had polycystic ovary disease, or you belong to a certain ethnic race where diabetes is commoner. And finally, if you've had a previous baby bigger than 4.5 kilograms. So what to do? Measuring the blood sugar between 24 to 28 weeks by your healthcare provider. You may be required to drink something sweet and do the blood test. The blood test could last for an hour or 2 hours. You do not need to be in the lab for the entire time. And in fact, you may wish to stay in your car and come back for the blood test. There are other things that you could do if you have risk factors. Healthy eating, exercises, gaining the recommended weight, and getting tested on time. If you're diagnosed with diabetes, your healthcare provider will suggest lifestyle changes, frequent blood sugar monitoring, and you may require medication if all the lifestyle modification does not work. During your visit, your healthcare provider will feel your uterus, wanting to determine the position of your baby, whether your baby is lying across or is head down or bottom first. At this stage, it's not so important until you are 36 weeks pregnant. Your healthcare provider would also like to know how your baby is growing by measuring the height of your uterus. This is called symphysis fundal height. The measurement is taken from the top of your pubic bone all the way to the top of your uterus. The number in centimeter will correspond to your pregnancy in weeks. This is a crude way to determine whether your baby is small or big, or if you require further ultrasound. It's important each time you see your health provider, he or she would listen to the heartbeat of the baby and will tell you about the rhythm and the rate, if this is normal or not. You may ask if you could record this to share with your partner at home. As you know, most offices are discouraging partners to come in order to reduce the risk of transmission of COVID-19 to other pregnant women like you. Triage of labor and delivery. It's important for you to know exactly where the triage of your delivering hospital is located. For example, this is located on the second floor at North York General Hospital. It's important to know that if you have any concerns, you need to go there. A copy of your antenatal record would have been sent to the triage ahead of time. You will be seen by a healthcare provider, and may I assure you that triage is open 24 hours, 7 days a week, 365 days of the year. It is also important that you do not go to the emergency room during your pregnancy after 20 weeks of gestation. What else should you be looking for that would make you go to triage? Let's start with the ABCD. A is the activity of your baby. Your baby should ideally move 10 times in a 2-hour period. If not, you want to count. If the activity is reduced, you want to go right away to labor and delivery. Secondly, bleeding is abnormal during the pregnancy. If you bleed and it's fresh and you are soaking your pad, you need to go. Mild irregular contractions, which is the C, it's normal. It's called Braxton Hicks. They're typically painless. If you have regular painful contractions lasting more than 30 seconds and it's going on for more than 2 hours, you need to go. Discharge or water breaking. If you notice a sudden gush, which you cannot control, or persistent leak, which is causing your underwear to be wet, this may indicate that your water is broken and you need to go to the hospital right away. There are frequently asked questions about COVID-19 and the effect on your baby. Let me reassure you that right now, there's no data to show that COVID-19 causes any congenital abnormality in your baby. We also know that there are very, very limited data about the effect of COVID-19 on transmission from the mother to the baby. And lastly, we know that there are few data that is just coming out indicating that women who are COVID-19 positive, their baby may become distressed and need to be born early, and they may need an ICU admission. Otherwise, please be reassured that the risk to you is minimal. So please remember to fill out our anonymous survey that we will use to research the impact of our educational videos on you. And check out the description of our handout or click the link for more information. Congratulations, you've made this far, and please continue with our next series of videos.